After a breast reduction, people are always a little worried about when their first mammogram should be and what's going to be found with it, because things do change on the breast. Right after surgery, we don't recommend having a mammogram done. First off, it would be so uncomfortable you wouldn't be able to tolerate it. Think about that pressure from the mammogram machine. And also, with the swelling and the scar tissue, things have to have a chance to settle down before any of it will make any sense. So usually we wait for the first mammogram to be at least 6 months after your surgery. And at that point, the mammogram reader will have to come up with kind of a new idea of what's normal for you. So don't be freaked out if they request either more views to be done of the breast because they see something that's changed or different, or that they request to do like an MRI or an ultrasound, because they just need to kind of figure out what's normal, what's changed, and establish a new baseline of what's there. Now, having a breast reduction does not increase your risk at all of getting breast cancer. It doesn't make it harder for them to find, but they just need to figure out what's normal again. And one of the things you can do to make that easier is to make sure that you're doing your self-breast exams. That can start right away after surgery, and you'll be much more knowledgeable of what's normal for you and for your breast than anybody else who does an exam once a year or a mammogram infrequently. You need to be aware of what's going on in your own breast, because you'll know if something's been there or if it's something that's developing that's new.